Fat transfers have been growing in popularity in recent years, so we spoke with Dr. Vijay Bending-Navale about how that technology has improved and some other reasons that people may choose to get this procedure done. Dr. Vijay, today we're talking about plastic surgery involving fat transfer. Can you explain how that technology has improved for patients over the years?
A few years ago, if people had volume deficits, that means in areas with the depression, either due to injury, surgeries for removal of cancers, or just age-related issues, or cosmetic issues, we really didn't have a great way to fill those voids. At this point, we've gotten pretty good at harvesting fat from the person, cleaning it, and re-injecting it into just about any area in the body and having it survive long term. So these are fat transfers and they work very, very well. We have a high degree of survival of these fat grafts. Of course, the most famous one, or the most commonly one that people talk about is the BBLs, or the Brazilian butt lifts that big on social media. Very commonly done. We do it in our office. Survival rate is excellent. But that's not the only application. It's a very good application that we do. But the other applications involve injections of fat into areas that have been treated with radiation, for breast cancer, for example, or skin cancer, or areas along burn scars, or age-related fat volume loss in the face. So there's really a myriad of applications, and the technology's gotten excellent. So what you can do is you can harvest the fat. Of course, it's important to realize that this has to be done at the same setting. In other words, you can't take some fat and save it in a refrigerator and just come back every so often to have it re-injected. It needs to be done in the same setting. And the safety, as long as you go and see a good certified plastic surgeon, is excellent.
Is this something viable now more for men? You talk about the Brazilian butt lift for ladies usually.
Right.
What about men who have that ever increasing problem as age overtakes us with a smaller behind that
Absolutely
may not work with clothes or comfort or any number of things?
It's absolutely true. Men are as good a candidate as women. The only thing to always remember is the medical status. You want to make sure that you're healthy, don't have any medical contraindications to undergoing elective procedures. But men are excellent candidates, most certainly. They do very well with it.
And I don't know if this applies, but once we talked about the eyelid tuck, is that kind of the same technology?
It is somewhat similar. Eyelid tucks, you're removing skin and fat. You're moving some, but you're not really sucking the fat out, cleaning it, and re-injecting it. Especially in the lower eyelid, you're moving fat around. And fat injections can be added to the eyelid tuck. But the traditional eyelid tuck doesn't involve fat transfer in the sense that we talk about harvesting fat from one area and injecting it to a totally different area.
Good to check with your plastic surgeon.
Yes, sir. Thank you very much.
Thank you, Dr. Vijay. Appreciate it.
Yes, sir. My pleasure.